The Natural Health Show likes to welcome Dr. John Hayes Jr. since 1981 in private practice, specializing in successful multidisciplinary health care with a focus on integrated case management. Of course, a great author. He is the author of the Evie-nominated Living and Practicing by Design and the Outskirts Press bestseller, Beating Neuropathy, Taking Misery to Miracles in Just 5 Weeks. Love that subtitle. Dr. Hayes, welcome on.
Thanks, Mark.
Hey, you know, so many folks, of course, wonder, when I go to Dr. Hayes, what's going to happen? What kind of assessment's done? What kind of interaction can they look forward to?
Well, I think probably the most important thing, Mark, and I do mean the most important thing, is the time that we spend with our patients getting to know them. There are so many factors in a patient's health history that oftentimes get overlooked. There are factors in a patient's lifestyle, including occupational history, especially related to neuropathy, that can have a big impact. And of course, as you well know, the nutrition status is oftentimes an enormous part of what's ailing them.
And I think we sometimes get caught up in the technology of healthcare, and you know, a lot of folks really don't appreciate, or maybe have lost track of the missing art of making a real connection with people to people.
Absolutely. You know, you raise such a good point. You know, right now I'm privileged to be teaching college students, and what I try to emphasize to them at this particular point in time, especially where there's such a shift towards technologically based medicine or healthcare, if you will, that the physical examination is indeed becoming a dying art, but you can just glean so much by spending that time with the patient and also doing a very, very careful physical examination, which can be done with very, very simple tools. The biggest thing is it takes an open mind, and it does take some quiet time, and of course the doctor's awareness.
Well, and of course the patient knows so much more about the patient than anybody, and that creating that kind of great connection between practitioner and patient is a great way to open that up and encourage that to come forth.
Right, no question.
Now what about, you know, we talk about patient's lifestyle. I mean, you know, the idea of everybody coming from a different subculture, different world, different family system, a different work environment, a different ability to manage stress, a different you know, time frame for good nutrition, exercise. How does that play a role?
It plays a huge role because, as we talked about in an earlier program, patients in particular who have issues with, let's say, blood sugar, which are absolutely huge in our society, who don't exercise, perhaps don't get enough sunshine, therefore, you know, lack vitamin D. I mean, the list just goes on and on and on. Patients that have had occupational, you know, histories. For example, somebody has a very sedentary occupation. Contrast that with somebody who's had a very, very physical occupation. Both of those can be risks for certain forms of neuropathy.
And what do you have to say for so many folks out there who are sort of what I call purple pill mentality people? You know, the idea that medicine's all about just give me the next super pill, you know, as opposed to taking the time to really get your nutrition together, your exercise, your lifestyle, manage your stress, etc. There's still an awful lot of emphasis on the pill as the solution. What do you have to say about that?
Well, there is, and unfortunately a lot of that is being driven by the media because, Mark, some of the best medical physicians I know, the first thing they do when our patients present to them is literally take them off medications, because those excellent physicians do indeed know that oftentimes, in many, many cases, you know, medication, especially self-medication, can mask a patient's problem and many times make it worse.
Sure. Well, and exactly, and I think there's an awful lot of information that we all get all the time with regards to patients when they're weaned off a certain medicine, they actually have an improvement.
Absolutely.
And that's something we're not really accustomed to thinking about.
Right, right.
So when we talk about nutrition as a vital part of this whole natural medicine process, what do you think are the real key elements to good difference-making nutrition with regards to health?
Well, you know, I think the biggest thing, first of all, is to try to simplify for our patients as much as possible, and that is to make sure that the diet as much as possible is plant-based. You know, by plants we're talking primarily about vegetables, you know, limited amounts of non-sugary fruits, nuts, small amounts of whole grains, and that type of thing, but you know, plants basically should make the cornerstone of the diet. There's also a good argument to have non-milk type proteins in the diet, you know, lean chicken, fish in particular.
Now, you know, that sounds an awful lot like the inspiration was somewhat paralleling the China study, the Great China study.
Absolutely.
I'd like you to comment on the China study.
Well, you know, there are some very, very frightening statistics when you take a look at dairy consumption and illness. Not only adults but children. There are, so many issues surrounding milk consumption on both sides of the aisle. I will tell you that one of my instructors a long time ago said, look at it this way. Milk really is a hormone delivery system for a different animal. And when you start to think of it that way, you'll think twice before you consume any significant amount of dairy at all.
Well, and again, the China study is really, it's an ongoing study that has been happening since about 1983 or so.
Right.
And when you think about the information, the vast population information that's been accumulated there, it really suggests that plant-based food is really where it's at. Plant-based protein and moving slightly into the vegan direction is really where it's at.
Absolutely, no question.
And yet America is still a big animal food country, I should say. Where there's a tremendous amount of meat consumption, dairy consumption. So I think most of us are starting to realize that the idea of those animal proteins and those heavy mucoid foods like dairy products are really right at the cornerstone of a lot of conditions and diseases.
Well, dairy for sure, especially those families that have dairy at every meal and consume significant amounts, really need to take a hard look at their health.
Right.
Good nutrition is a balancing act, and I guess the biggest thing I tell patients on is focus on the 80%. Don't worry about that occasional holiday or birthday party, but focus on what you're doing, 80 to 90% of your days. And that's where you can really have the biggest impact upon your life without driving yourself crazy.
And when a patient asks you, what vitamins should I be taking, I know you probably try to individualize that, but in a kind of generalized sense, what supplements would you generally find yourself recommending?
Well, I think probably the biggest things right now are, of course, the omega-3 essential fatty acids, especially if the patient's diet is low in seafood or nuts in particular. We're just adamant, as I'm sure you are, checking patients' vitamin D levels, which are just so critical to health. But beyond that, blood sugar levels and monitoring what's called the hemoglobin A1C, which is for more long-term blood sugar levels. And the reason I say that in neuropathy is that we know that relatively moderate imbalances in blood sugar, sometimes imbalances that are considered quote-unquote normal for your age, you can actually be developing neuropathy for 15 to 20 years before you're actually diagnosed with having diabetes or metabolic syndrome. So it's so critical that patients pay much more close attention to their diet.
Dr. Hayes, last time we spoke, we talked a great deal about your book, Beating Neuropathy, Taking Misery to Miracles in Just 5 Weeks. We didn't say too much about living and practicing by design. Tell us a little bit about that book.
Well, that book, Mark, was a book that I started to write in 2007. I published it in 2008, and it really arose out of my frustrations with what the healthcare system was becoming and now ultimately has become. Very, very disconcerting. And, my role now as a teacher and educator, not only for patients, of course, but for healthcare professionals, is to teach them, if you're going to have a private practice, you've got to take care of you as the provider just as much as you do your patients. And our mainstream healthcare system does not do that at all.
Great point, great point. And why don't you share with us any kind of website information, telephone information, contact information, and where people can buy your books?
My books are available at Amazon. They're also available in any major reseller. If they're not on the shelf, simply ask and the clerk will get one for you. But more than that, links to my books are contained at my patient website, which is NeuropathyDR. That's neuropathy with the letters DR.com. Or if they need personal assistance, they can call my staff at 781-659-7989.
That's Dr. John Hayes, Jr., and of course his two great books, Living and Practicing by Design and Beating Neuropathy, Taking Misery to Miracles in Just 5 Weeks. Dr. Hayes, thank you so much for being on board.
Of course, Mark. Thank you so much.
Well, for an early morning, it was pretty good.
Yeah. Sometimes it's just better to do it.
It is. That's great. I'm glad we got those.
Thank you so much.